You guys are amazing. I've loved learning from you today. This has been fun. So how do we make this connection and close the gap between real human behavior and medical innovation? I mean, think about it. We've been doing heart transplants for over 30 years. But in that same 30 years, morbid obesity rates have doubled. Today's healthcare spending, we all know, is 5 times more than all spending on national defense and aerospace combined. So what the heck? So we can land a spacecraft on distant planets and we can transplant hearts, but we can't stop eating cheese fries. So it's rational people making irrational decisions every day. Did you eat one of those chocolate chip cookies at lunch today? They were amazing, I thought. Our rational brain knows this is a stupid idea. But then our core primal brain takes over and says, just give me the freaking cookie, right? So that view of human behavior, this two-system view or the two-person view or the rational and the primal view of human behavior, that view has shaped my research and my work for over 30 years now. My family and I, we live in the remote interior of Alaska on the Copper River Valley, and we live among the Otton Native Athabascan tribal people. And that's an area the size of West Virginia. Our winter temperatures sit at 30 or 40 below zero. So when you walk out your front door in the morning, that's a 100-degree drop in temperature when you step across that threshold every morning. It's exciting. Years ago, I used to sit with tribal elders and listen to these amazing stories they would tell me of when they would grow up in the 1930s. They spoke their Otna language back then. There was no English. They rode dog sleds over 100 miles to the big, great dances in the region and the clan celebrations. But then everything changed. In their lifetime, elders I spoke to, their entire culture was uprooted. They, as children, were shipped off to boarding schools, and that began a cycle of trauma that lasted for generations. Now, we see this same trauma profile in rural cultures across the planet, from Peru to Appalachia, but also in downtown Philadelphia. When you see somebody exhibiting inexplicable self-destructive behavior, you are probably looking at a response to past trauma. Now, those of us who study trauma response, we quickly learn in our careers, if we're honest with ourselves, you and I and everybody we know, all of us sometimes exhibit elements of those same destructive behaviors. We quit a clinical trial, and we can't really explain why. We quit a relationship, and we can't explain why. It's a tiny bit of trauma response mixed in with their already pre-existing primal substructures. Now, in the rural environment, we face staggering levels of trauma in the rural environment. So inspired by those tribal elders, we set out to bring an exceptional healthcare system to our valley. Now, we led big innovations in clinical integration, clinical modeling, clinical delivery, and social determinants programming, but also hundreds of tiny little innovations that made big, big differences in closing this gap between real human beings and medical models. Now, I'm normally asked to speak about clinical innovation, but today I want to talk about those tiny little innovations and the cool stuff they did. The Anchorage Emergency Hospital System, for us, is 200 miles away. So that's a helicopter flight to get to the ER room. And so if a gunshot wound happens in our area or a heart attack, we're it. Now the big problem, though, is our doctors are family practice doctors. They are not ER doctors, and the skill sets are completely different. So time and again, I watched our team, our doctors, call the ER doctors in an emergency asking for help. Then they'd jam a phone in their neck, and they'd work with the patient while at the same time trying to explain to the doctor what's going on. It was a nightmare. So in 2016, we had this crazy idea. What if we could build live, two-way, multiple video streams that could somehow teleport the ER doctors in Anchorage to our ER bay? And with multiple camera angles and big screens, they could see everything happening in the emergency, and they could guide our team through the procedure. The Anchorage team said they loved the idea, our team said they loved the idea, so we built it, and nobody used it. They just kept working with the phone jammed in their neck. And they couldn't explain why. My team could not articulate to me why in the heat of the moment they just kept picking up the phone and working with the phone in their neck. We had a primal problem. And the answer was an easy button. So it turns out in the heat of an actual emergency, there's a lot of adrenaline, a lot of noise, especially in a team that doesn't do it that often. Nobody wants to try to remember how to log into multiple computers to start multiple cameras and multiple screens. So I asked our technology team, please make the entire system start with the push of one easy button mounted by the door, and immediately our medical team leaned into the project. An easy button. Another one of our tiny innovations was easy patient feedback cards. Old-fashioned paper 5x7 cards. Yes, of course, we tried all the latest and greatest digital patient feedback systems, and they all failed. So our communications team had this idea, let's go retro, and let's make it easy. So we took a new pen and a card and placed it on the patient chair in every exam room. And then the nurse asked each patient, please keep the pen, and please let us know how we're doing, because your ideas make a big difference around here. The results were magic. Patients wrote and wrote and wrote and wrote. They gave us great ideas. They told us stories. They told us when we screwed up. They thanked our team members by name. They thanked us for listening. Now that card just had 3 simple questions on it and then a place for comments. The first question was this: what was the wait time for your visit today? Then there are 5 options, 0 to 5 minutes, 5 minutes, 10, 20. You get the idea. Now, we knew that 99% of all patients would circle 0 to 5 minutes because at CRNA, nobody waits more than 5 minutes ever. We did not need any data on patient wait time. But that question reminded the patient, wow, that was fast. I barely got seated before the nurse came and took me back to my appointment. The second question, how satisfied are you with the cleanliness and appearance of our facility? Now this was a 1 was I was disappointed, 5, I'm amazed. Most patients circled amazed. The third question, please rate the quality of your care today. Again, 1 is disappointed, 5 is amazed. Now, a simple smile, some empathy, and an extra 30 seconds to look a patient in the eye and to actually listen to them almost always moves that score from 3 to amazed. But here's the real magic of the card. This card had 1 word, comments, and 3 blank lines. Now, when a patient has already been amazed by at least one aspect of their care, for some reason, they are eager to leave a comment. I have no idea why it works, but it does. They write, and they write, and they write, and they write. Magic. In 2011, U.S. venture capital firms invested $3 billion in healthcare innovation. In 2021, they invested $30 billion in healthcare innovation. Today, we face a tsunami wave of incoming new technology. Hundreds of companies trying to push their new innovations into the healthcare space. But think about this. How many new technologies can a single hospital or clinic ingest in 1 year? How many sales pitches can I possibly listen to in a year? And then there's the training, the retooling, the validating, the certifying, and the accrediting. We have reached a point in healthcare of total innovation saturation. And because of that, good innovations, innovations that save time, lives, and money, will fail simply because we don't have the time to adopt them. Any administrator in healthcare today knows this. You can absolutely ruin your Monday and make your entire medical staff want to revolt simply by walking into your Monday morning provider team meeting and saying, great news, everybody. We have a new app that you're going to start using. They hate your new app. They aren't listening to you. They're angry. They're sick and tired of new. Every time you turn around something new, a new scope, a new procedure, a new protocol, a new person. And in healthcare, new means time, a huge amount of time. When a healthcare administrator walks in and says, we purchased a new app that you're going to start using, that new app is instantly poisoned with raw, emotional, primal dread. You see, right about here is where innovators will say to me, oh, but wait, you don't understand. Our new app will save them time. It'll save money. It'll save lives. Just stop. I just said, just stop. See, you are making a mistake. You are making the mistake of being logical. You are being rational, silly, foolish mistake. In a Monday morning provider team meeting, those doctors are thinking with their primal brain. And to the primal human, anything new being pushed in on us from the outside is an invader. And what do primal humans do to invaders? We kill invaders immediately. They hate new things being pushed in on them. So innovators, you want to create pull demand. You want frontline healthcare teams, medical teams, talking about your app, your innovation, your technology in organic, peer-to-peer conversations with each other, where they're saying to each other, have you heard of this new technology? It's amazing. When I was a healthcare CEO, I completely ignored the herd of vendors trying to get my attention all the time. But if my own team came to me with an idea for a new app, a new technology, a new device, I would do everything in my power to give it to them. Elderly patients everywhere struggle with medication and treatment plan compliance. At CRNA, we noticed something happening. Elders were coming to our campus and just hanging out all day long. So we knocked down a bunch of office walls and built a great big dining area with a commercial kitchen in it, and soon we had 100 elders joining us for lunch every day. Then I had our medical team come over and eat lunch with the elders. And then after a while, at lunch, they began to provide medical exams and case management reviews during the lunch hour in the lunchroom. Medical compliance skyrocketed. Then after lunch, we built new programs. We built exercise programs, fall prevention, and physical therapy. We saw elders go from wheelchairs to using walkers to walking with a cane. It was really something really neat. But if we think about it, and if we're honest with ourselves again, compliance with our medications, our treatment plans, that's a challenge for all of us, not just the elderly. Doctors, the orders they give us at the end of an exam, all those instructions, they're hard to remember. That white sheet of paper they give us, it's easy to lose. And the new app I downloaded, my doctor doesn't know how to use it. A, B, now it's locked up, wants a new password. So as a result, we take 2 pills instead of 3, and we forget at least one of our 5 rehab exercises. Guaranteed. But if I took a hot pink sheet of paper and held it up in front of you right now, it would rivet your attention. You would just keep glancing at it. At CRNA, we started to print patient instructions on a single sheet of hot pink paper. They became known as the CRNA pink sheets. At the end of every medical visit, the doctor would sit with the patient shoulder to shoulder. We call it shoulder to shoulder care, that's what we call it. And they would review all the instructions on the sheet. And then the patient would sign at the bottom of the sheet with their new pen. And then we sent the patient home with that hot pink piece of paper. Now, we did not need that signature. We didn't even keep a copy of it. It went home with the patient. But immediately, patient compliance jumped up across all demographics. Patients loved their pink sheets. Many of them folded them and kept them all the time. In our reception areas, we would see flashes of hot pink all over the place, in people's hands, in their pockets, carrying them around. Those were all the patients returning weeks later for follow-up exams with their hot pink piece of paper. I believe and I'm convinced that the pink sheet could be digital and should be digital. I need one of you to develop that process, that project. But it's not an app. It's a device. It's something we can hold, carry, touch, and feel. You know, we go to a lot of different doctors for different reasons, different specialties, and those doctors always want to know, what other medications are you taking? Our various clinics, the different doctors begin to ask patients, hey, do you mind if I glance at your pink sheet? I think some innovators need to take that idea and run with it. We are all primal. It is the silliest little tiny things that grab our attention and shape our daily behaviors. Knowledge and data are not enough. Price transparency, quality transparency, health content, food labels, massive public health awareness campaigns have all failed to substantially move the needle of human behavior. When it comes to clinical trials, something I'm learning a lot about this weekend, I'm betting people enroll for rational reasons, reasons based on knowledge, but they drop out for primal reasons, reasons they really can't explain. So innovate for the primal person. Real people like me, and probably you, who just can't stop glancing at a pink piece of paper and love easy buttons. And a single chocolate chip cookie has inexplicable power over us. Innovate for that person, because that is how you will revolutionize healthcare. Thanks for listening. You guys have been great.